A very good evening to you. You're watching UBC TV, and thank you so much for joining me on You Health Chat. My name is Sophia Matovo, and today we are going to be talking about a condition that possibly affects many of us, or many people in a particular age bracket will get to find out, but sadly you might not know what it is, or you might not think that that is what you're undergoing, and that is none other than chronic fatigue. And an expert to take us more into it, because he meets many of the people who are struggling with it, is none other than Dr. Paul Kasenene. Good evening, doctor.
Good evening, Sophie.
How are you?
Fine, thank you. Thank you for having me.
Okay, thank you too for accepting to be here with us. Now, doctor, maybe you might start by just the usual way of helping to break down for us. When you talk about fatigue, what is fatigue?
So basically, fatigue is a condition where you either feel like you have low energy or you feel tired. And I know these seem to be the same, but they're a little bit different. Now, typically, people have cycles in their normal day where you feel tired and you feel exhausted. But what happens is that your body should be able to recover naturally. And by morning, usually, you should be fresh and ready to go. So we do have circumstances and situations where this feeling of fatigue or tiredness tends to persist. And if it persists, beyond 2 weeks, and especially when you're trying to get enough rest, and you feel like getting enough rest, then you start to experience what you call more chronic fatigue. And sometimes it's the point at which you need to figure out what's happening and is there something I can do about it.
Now, on a regular, let's use a scale of the patients you meet. What percentage would you say come in with this kind of condition to you?
So typically, most people will not come in presenting or with their primary complaint as fatigue, but we do have a set of questions that we collect from our clients before they come in to just try and understand their situation better. And what we do find is that maybe 7 out of 10 will mark fatigue as one of the things that bothers them. And that means it's at a level at which they feel it's something that is worth mentioning because they are not comfortable with it. So about 70% of our people will actually tick that they have fatigue as a problem.
Okay. Now, what are the causes of the fatigue?
So it's important for us to understand that, the most common cause of fatigue is usually not getting enough rest. Okay? And so we usually like people to assess whether they're actually getting enough rest or not. And typically this means you want to have, on average, 6 to 8 hours of sleep. I say at least 7 to 8 hours of sleep. Continuous sleep each night on most days of the week. Now, if you're getting that and you're still tired, then you need to explore other things. Now, the 3 most common causes are either not getting enough sleep. The second is that you're anemic or you have a low hemoglobin. This is one of the silent causes of fatigue that most people don't actually know about. And it tends to happen more in ladies, especially because of the menstrual cycle where you have a low hemoglobin level. And then the third thing is sometimes people tend to develop a thyroid issue. So after age 35, for some people, their thyroid starts to slow down. The thyroid is a gland around the neck that's primary role is to regulate energy and metabolism. So these are the 3 things that tend to be the main causes of fatigue. But what I see in my practice is that there are two other things that seem to be predominant drivers of fatigue. The first one is what we call adrenal dysfunction. So we have adrenal glands. The adrenal glands are 2 glands that sit above our kidneys, and they are most popularly known as the stress hormone gland because they produce adrenaline, like the word adrenal, and cortisol. Adrenaline is the hormone for fight and flight. It gives you a lot of energy. Cortisol is the stamina hormone. Now, these 2 hormones play a very vital role in our energy and our survival and the state of our body function. Now, if you've experienced a lot of stress and your body has had to pump out lots of cortisol and lots of adrenaline, sometimes this gland gets tired. And so it's no longer able to produce the same amounts of cortisol that you need to maintain a certain amount of energy. And then you get what we call adrenal fatigue. Now, I find that this is usually the most common cause of what we call chronic fatigue syndrome. And this presents where you feel really tired and you want to sleep. And even when you sleep, even if you take leave for 2 weeks, even if you sleep 7, 8 hours a night, you still feel tired. And this can be addressed, but it tends to be a very common cause, in my opinion, followed by gut health problems. In fact, when somebody has fatigue, one of the first things I will ask them is, do you have gas and bloating in your stomach? If you answer yes, it's likely that that is driving your fatigue. And I'd like to explain to you how that works. So, our stomach lining is intact. It's supposed to allow in only food at a particular point in our intestines. Now, sometimes when you are stressed, your stomach becomes very sensitive because your stomach or your digestive system is the emotional brain. So then certain foods that we eat or certain medications, and these foods are mainly wheat-like foods, milk, eggs, groundnuts, certain foods, fish, beans, they cause inflammation in that lining, and then your lining becomes leaky or porous. So when your gut has small little holes, food can pass through prematurely. Now your immune system recognizes that and tries to mount a response to stop that. Now the response that is mounted as a result of that leakiness causes fatigue, but also causes 6 other symptoms. And people can actually begin to recognize if they have this. They will also have trouble with sleep. They will struggle to fall asleep, or they will find it hard to fall back asleep if they wake up. Others will get headaches. Others will get what we call brain fog. Now, brain fog means your brain doesn't focus and concentrate the way you want to, or your memory isn't so great. Some will have lower back discomfort, and then others will get hormonal imbalances that will present as fatigue, easy weight gain in the midsection, hormonal imbalances around your menstrual cycle if you're a lady, premenstrual syndrome, and a low mood and low libido. So all this tends to be one symptom around a chronic fatigue syndrome that begins in the gut. Of course, we also can get fatigue if you have mental health issues, like if you're getting depressed, because when you have depression, your neurochemistry balance from the brain is altered. That affects your energy system. But I think one of the key messages that I think is important to share is that our body has an energy generating system that is found in every cell. Now, if people were attentive in biology, there was a word called mitochondria. I don't know if you remember that word. There are small little cells the small little organs in our cells that are energy producing factories. So they use glucose as the primary driver, and then there are certain raw materials like magnesium, like coenzyme Q10, like all the B vitamins. They come in and they help to transform the glucose into energy. Anytime you don't have the right nutrients, or you have a problem in this factory, then you struggle to produce energy.
Wow.
And all the things we've talked about, like adrenal dysfunction, can always tie into it. But of course, a big thing is always your diet. If you're not eating foods that are high in magnesium, omega-3 fatty acids, B vitamins, you're going to struggle with fatigue. Interestingly, one of the big things that causes fatigue is sitting a lot and not exercising.
Wow.
And so many people find that they don't have energy to exercise because of fatigue. But ironically, that's the same thing that's making them tired. So there's so many things that can actually cause fatigue, including dehydration. And so I think it's important that when someone is fatigued, before we brush it off as just, oh, I'm not sleeping enough, or I had a long work day, it's important to try and think about all these things. Yeah.
Now, as you have broken it down, among the category of clients you see, who are those that stand out predominantly in terms of the sex? Is it the male or the female? And possibly why do you think that particular gender seems to be most affected?
So first of all, it seems to be more predominant in females, okay? And that's because females are more hormonal beings than male. And so they tend to actually get more hormonal imbalances. But men can also get adrenal fatigue. I think also a big part of it has to do with the fact that women are better at healthcare seeking. And so they tend to, go to look for care when they have an issue. But it's generally, I think the literature says maybe there's 3 times higher chronic fatigue in women, but also because of the kind of things that women do. Women by nature have a lot of demands on them, and we also see it in working class, mothers. So if someone is a mother, is working class from age about 30 to about 50, that's when you typically will see this. Because you see, you're a mother, at the same time you're working, you're a wife, and women are usually also caregivers for their parents, for their siblings. So they tend to be the ones who easily get burnt out. So yeah, and so it's very important that if someone is experiencing these things, they should be able to identify that they actually have a fatigue imbalance.
Then how about the fact that some people, when they feel tired, will instead resort to energy drinks or something that kicks them, up and gets their energy levels up there, and possibly they don't realize that it's actually fatigue?
So, that's the interesting thing. The world we live in has kind of made us believe that it's okay to be tired, that this is a normal consequence of what we do, that you go to work, you're busy, it's a pressure-driven world. So fatigue is part of the package. And so we also have been taught through the media and through, different forces that, just pick myself up. And what we tend to use are stimulants. Now, in the short term, the fastest stimulant are energy drinks. Anything with caffeine, coffee, a soda with caffeine in it. These tend to be the quick pick-me-ups. And because they give you a false sense of energy, not because they produce energy, but because they stimulate the brain, you kind of feel like they gave you energy. But some people are also using alcohol because fatigue can actually, if you take alcohol, you may feel like that fatigue has been kind of calmed down. So it's true that many people are resorting to stimulants, whether it's alcohol or caffeine-driven drinks, or even these recreational drugs. People are actually resorting to those, and it's very important that we realize that these can have major long-term negative harmful effects on our body. And so, if you're feeling tired, let's not resort to the energy drink. Let's not resort to the stimulants. Let's try and understand what it's doing, what is causing this. And it's not very complicated, interestingly. It just needs you to be honest with yourself, to look at your life and see what you can do to get your health back on track. Okay.
Now, are there any physical, because there are certain times for some of those conditions, at least for you, how you're able to diagnose is you have that form. But medically, if you didn't have that checklist, how would you diagnose it? Because certain times people struggle and will even go on to points of self-medication, given if one gets a migraine headache, you're quick to take action, You're quick to take whatever it is because you're not realizing that it's actually fatigue.
So what I know for sure, or what I would advise, is that the parts that tend to suffer are the places in your body that use the most energy. Now, the parts that use the most energy, the first is your brain. So once you start getting brain-related symptoms, however mild they are, I can't remember someone's name, I'm becoming forgetful. I can't focus enough. I want to take frequent breaks. I'm getting a headache. I don't sleep well. These are the first signs that should let you realize. The next are the muscles. The muscles use about 20% of our energy. The brain, I think, is about 22%. So we tend to find that people will get muscle aches. Unexplained pain in your muscle, especially in the morning. People will always say, I wake up in the morning and I feel like I was running a marathon. Yet I've just been sleeping the whole night. So if you have pain in your muscles or discomfort in your muscle, that can be a sign of fatigue. And then the gut. So this gas, this bloating, this constipation. These are the things that tend to go along with fatigue. In fact, these are part of what we call the chronic fatigue syndrome, triad, where you have these things and they help us to actually let someone know that, This fatigue is beyond just feeling tired.
Who is at risk, or what are the risk factors around fatigue?
So, number one risk factor is, stress and high pressure driven world. So many of the working class people are at risk for fatigue, especially if you have this mentality that I have to push harder, work longer hours, and try and drive myself in order to get results. So we tend to find that the working corporate person is high risk. Now, people who have emotional issues, so you have challenges with your marriage or your relationship, or you have challenges with your family, or you have a sick parent to take care of, these are the people who also tend to become at risk. In fact, we tend to find that people who give a lot of themselves tend to have this as an issue as well. Then, of course, people who don't eat very well. Now, if your diet is poor, you're automatically high risk for fatigue. In fact, many of my clients, within 2 weeks of changing their diet, will report that they have more energy. So if you're not eating well, you're going to be high risk. If you're not sleeping enough, and there's a lot of contradictory information about sleep. There's this philosophy that there's no time for sleep. I mean, life is short. Work hard, go, go, go. But yet, on the contrary, what we do know is if you don't sleep enough, you're not able to perform enough, so you need stimulants and things like that. And then, of course, not getting enough exercise. Lastly, people who are overweight. If you're overweight, you're very high risk for fatigue. So I would say to the people who are high risk, I mean, ladies, if your menstrual cycle is not regular and you have what we call dysmenorrhea or a very heavy period, you could also be at risk. So it tends to be around our lifestyle choices, around the things we do every day. And that's where our risk tends to be.
Wow, wow,
Yeah.
wow. Okay, now, when you are able to finally diagnose and know that this is what it is, how do you manage? Because certain times, of course, if you're not there, and assuming people go to the hospitals, some of them have ended up saying they're being given antidepressants. And there is a particular famous one, is it amitriptyline?
Amitriptyline.
So they get to be given.
So, like I was sharing it before the show, our training, and I'm speaking for Uganda, in medical school, is we are trained to identify and treat serious problems. Now, many times people are going to the doctor with these kinds of complaints. I feel tired, I don't sleep very well, I have joint pains. Now, what we tend to do as a doctor is you run tests. You do a blood count, a liver function, a kidney, so everything is fine. Now, when you find that everything is fine and someone is continuously complaining, they say, maybe you're depressed. Okay? And that's how the story around depression comes in. And then these amitriptyline drugs, like amitriptyline, pregabalin, they have sedative effects, and there's a way they work on your nervous system. So they can kind of make you feel a little bit, calm or sedated, but they actually don't solve the problem. So the first thing anyone should do is go for a checkup. Now, you want to do a blood count because you want to see, do I have anemia or not? So what we call a CBC. And you also want to check your vitamin B12 because a certain type of anemia is caused by a vitamin B12 deficiency, and vitamin B12 is actually predominant from animal foods. So although I recommend eating less animal foods, if you have a totally deficient diet of animal foods, you could get vitamin B12 deficiency, which could cause anemia. Then you need to also check your thyroid gland. Do I have hypothyroidism? These are tests you must check before you actually move forward, because sometimes this is where the solution is. Now, once you've done that, I recommend people to evaluate their lifestyle, and there are 4 areas we address: diet. And when it comes to diet, we have 3 things that are very important. The first is people must get off things that are highly refined and processed. So you have to get off sugar. I know sugar seems to give energy, but you want to get off sugar. You want to get off refined grains. This is your white bread, your cake, your chapati, mandazi. You want to get off processed meats. You want to get off deep fried foods. Now, the second thing you want to eliminate, and this is very important for people to know, is you want to eliminate foods that can cause gut sensitivity. number one is milk, because the milk protein casein can inflame your gut. It's not the lactose, it's the protein, the casein. Then the gluten in wheat. Then the protein from eggs, groundnuts, shellfish, soy, and yeast. So we do an elimination diet. This is very, very important. And then you want to give people foods that are high in magnesium, in omega-3 fatty acids, and in B vitamins. And so we structure a diet plan around this. And very quickly we find that we can get that factory in your cells working again, because we've removed the things that are poisoning it or disturbing it, and we are giving it the raw materials that it needs. And so this is sometimes very, very important. In fact, if you don't change your diet, you don't get much results. Now, in functional medicine, what we do is we also want to optimize this factory further. So there are certain nutrients that are extremely essential for energy production. And I hope people can actually remember this, but I'm going to just say them. The first is magnesium. So we will supplement with magnesium, with omega-3 fatty acids, with B vitamins, especially vitamin B12 and B6, with vitamin D, and then there are certain other core factors. Some of these things are very complex, so sometimes we say them and people don't know what they are, but coenzyme Q10, alpha lipoic acid. So you just supplement, give the client the nutrients they need, and then they get better. Sometimes you want to address the stress. What could be causing the stress, and you address that. But there are also things we call adaptogens, ashwagandha, cordyceps mushrooms, holy basil, rhodiola. These are natural herbs God has put that can provide balance. And then, of course, you want to address sleep, exercise, and hydration. If you do this, many people are able to come out of the chronic fatigue syndrome. Now, sometimes you need to go further in your evaluation, especially if somebody has features suggestive of adrenal fatigue. Adrenal fatigue is where your adrenal glands are tired, what we talked about earlier. And here we do a cortisol test and a DHEA test. And it's easy to tell someone has adrenal fatigue because the hormones that make cortisol, the stress hormone, the raw materials are the same ones that make sex hormones. So if someone has low sex drive, low libido, and is reporting stress, I don't even have to do a test. I can already know that you have a cortisol issue because of stress. So you want to also give people nutrients that will help to address that, but always to go into understanding what are the factors in your life. So it's really a multifactorial approach, but what I can say is that many people who are struggling with adrenal fatigue or just chronic fatigue will not get help with stimulants, with antidepressants, with sedatives, or with trying to just go and rest. You really need to get this holistic approach and understand what is driving the condition.
The condition, yeah, true.
Yeah.
At this particular point, we are going to go in for a very short break, and when we do return back from the break, we're still going to continue with our topic of discussion, which is chronic fatigue.
A good school doesn't tolerate violence against children.
Because a good school equals a better life.
Raising voices.
Welcome to the Living Room Stadium. It's the FIFA World Cup. The match is about to start. Food and drink ready. There's no space left for anyone. Come on, get your lucky chair. Take your usual spot. Even the puppy has one. It's preparation time. You can feel the tension in the air. And do you have everything you need to believe?
In the year 2020, the world was brought to standstill because of the COVID-19 pandemic. We lost friends, we lost relatives, we lost workmates during that very, very trying time. And we decided that we could remember them by establishing what we call the Remember Me book. We also appeal all Ugandans to plant a tree. We are aiming at 1 million trees in memory of those who departed from us.
We call upon individuals and institutions that lost any loved one to join us by donating and dedicating 1,000 trees at 1 million Ugandan shillings or more. To donatories, call 0700 513 660. This message is brought to you by My Tree Initiative.
Welcome back from that short commercial break. You're still watching You Health Chat, proudly sponsored by National Medical Stores. And of course, we're talking about chronic fatigue, and with me in studio is none other than Dr. Paul Kasenene. Doctor, before we went into the break, we were still continuing, and I was a little bit curious to find out about the foods, because when you did talk about the components that we look for or that will help us with some of the issues, you did mention particular things like omega-3, yeah? You did talk about the vitamin B, D, what and all that. So please, maybe as an expert, you could break down the foods, because it's a much more affordable way for people to go.
Yeah, thanks, Sophie. So I'm really happy you brought that up, because, you know, we always believe that supplements are just supplements. They are not substitutes. So we would not want people to think I can just take these supplements and I'm fine. So, like I said, magnesium is one of the most important of these nutrients. Now, magnesium, you know, sometimes I like to simplify it for my clients. So, where will you get all these foods? So, now the first A, so avocado, okay, and almonds. Okay, this is where you'll get magnesium. So, then when you go to B, you'll get it from bananas and beans. Okay, we're talking magnesium. When you go to C, you get it from cashews and cooked spinach. When you go to D, dark chocolate. Now, that's just to try and help people remember, in case they try to remember these foods. But you will also get magnesium from pumpkin seeds, from soy. And so it's important to think about these foods. So leafy vegetables, legumes, seeds. And being deliberate about this can help you to support your magnesium. Omega-3 fatty acids, people tend to know them as fish oils because they predominantly come from fish oils. By the way, fish are not the best source of omega-3, but they eat algae, which are high in omega-3s. So fish oils, now most people will talk about salmon, but even our tilapia can get omega-3s. Seeds, chia seeds, pumpkin seeds, and flax seeds are high in omega-3, and then nuts. Now, it's important people to understand, when we say nuts, most people think of groundnuts. But groundnuts are technically legumes. So when we say nuts, in this case, we're talking about things like almonds, cashews, pistachios. Now, I know these things are not very common and they're a bit expensive, but at least the seeds are more available. And then, of course, avocado. So actually, for the brain and fatigue, avocado tends to be very good. Now, the B vitamins, they tend to be found mostly in animal foods. Now, vitamin B12 is exclusively animal foods and bacteria. So if someone who is a vegan may actually not get enough vitamin B12. But again, salmon, liver are actually good sources of B vitamins. You know, I'm not an advocate for too much animal food. So sometimes when you say these things, people are like, oh, so finally we can eat these. But B vitamins is one area where I strongly recommend supplementation, because you may not always get enough from the foods. Yeah, so vitamin D is the sunshine vitamin. I mean, there are foods that have vitamin D. Some people, they're usually fortified foods, like they'll fortify butter and yogurt, but mainly it comes from the sun. So a natural diet, you know, sometimes you don't even have to remember all these foods. You just have to say, what do I need to eat? More vegetables, more fruits, more nuts, more seeds, more legumes, you know, and less of the processed foods. will usually sort you out. So diet is very, very important. Now, if you know, sometimes I'll be sharing with my clients and I'll realize that their diets are really lacking, because sometimes someone will tell you that for breakfast, I have milk tea and I'll have bread, you know, sometimes with jam and, you know, maybe an egg here and there. And then my break time, I eat samosas and I have a fruit, and my lunch is rice and, you know, chicken and, you know, maybe beans. And you realize you're not getting enough vegetables and you're not getting enough fruit. So it's really about understanding that I need to get more of fruits, vegetables, nuts, and seeds, and legumes. Legumes are beans, peas, and groundnuts. So if we can just try and factor in these more natural foods, usually we'll be on the right track.
Now, is this fatigue curable?
Yes, you know, we're talking before the show about how diabetes is curable, and many people are surprised when I say that. You see, in functional medicine, which is what I do, our philosophy is that don't treat the disease, treat the cause of the disease, or treat the cause of the problem. So if you don't treat the cause of the fatigue, then fatigue is always there.
Going to be there.
So you're always on these medications, on these stimulants and things. So if you understand what caused it, and like we said, if it's not anemia, if it's not a thyroid problem, if it's not sleep, then you want to address the stress factors, you want to address the diet, you want to address the gut, you want to address exercise. So the good news, it is curable and it can go. And you can actually go back to normal life and start to enjoy good health. So it is curable. That's the good news.
Then how do people, there's certain times, has it got to do with age? You'll find people have relapses. How and what is the cause of the relapse? Is it because you've changed your lifestyle and now gotten comfortable that you're well and you go back to your old habits? Or it's got to do with the system kind of like wearing out?
So first of all, they are what we call genetic predispositions. So some people are more likely than others to get certain conditions. So if you have a genetic predisposition to suffer adrenal dysfunction, then, you know, a little bit of a poor lifestyle will tip you into fatigue more than someone else. So what we do find is that once you've experienced adrenal fatigue, your body needs at least 3 to 6 months of a continuous proper lifestyle to go back to normal. What tends to happen is within 1 week or 2 weeks, people are fine. They feel fine. So they tend to feel that they're cured. So once you feel well, does not necessarily mean you've fixed the total dysfunction. So you need to do this continuously for 3 to 6 months. Then you will not see frequent relapses. But again, as long as somebody is going back to the same lifestyle or the same factors that led them there in the first place, that's when you get the relapse. So it's usually a case of people relaxing. And you know, fatigue is not like a life-threatening disease. So it's very easy for people to forget that they actually had fatigue once they start to feel better.
Well, how about okay, true, you say it's not life-threatening, but certain times, how about if it weakens somebody's immune system?
So you're right. Now, if chronic fatigue persists, especially adrenal fatigue, and you know, there's 3 phases of adrenal dysfunction, and I think we're talking about fatigue, maybe I should explain them. So the first phase of adrenal dysfunction is when you're in the heightened pressure, where you actually know that I'm tired, I'm working hard, but you're still coping. Then you go into the resistance stage, where you now start to feel fatigued and you start to feel unwell and you don't sleep well, but you're still coping. Then there's what we call adrenal exhaustion, where your adrenal glands can't keep you any longer. Now there you become sick. And when you reach that stage, your immunity will be depressed. You will have very low immunity, so you're high risk for infections, especially candida, even colds. Your hormones will be totally imbalanced, and you're very likely to get depressed. So it can reach a point where you reach into a situation where your health is so bad that you get medical issues. Usually by the time you reach that point, you now have a condition likely called Addison. So there are medical conditions that a doctor will pick up at that point. But you will have gone so far down in the spectrum of fatigue that you're actually at the point where you're weakened and you actually can get autoimmune disease. And autoimmune disease is actually one of the things that comes along with chronic fatigue. Autoimmune disease, maybe to just explain for the viewers, is really a condition where your immune system is so tired or is so has worked so hard that it gets confused, and instead of targeting foreign things, it targets your own body.
Your own body.
And so you start to suffer that way. Yeah.
Like vitiligo.
Yeah, like vitiligo, like rheumatoid arthritis, like lupus. You know, all these are autoimmune diseases.
Okay. Then is it true that if somebody has chronic fatigue, you know, they get to a point where they cannot even tolerate exercise?
Yes, that's a very important point. Because when you have chronic fatigue, your body, so exercise typically is mild stress, and mild stress is good for you, and mild stress builds you. That's why exercise is good for you. Once you've reached chronic fatigue, your body cannot tolerate mild stress. So when you exercise, you will actually usually feel worse, not better. And so many people will not exercise. So you will feel worse, and your muscles will actually feel terrible. Now, unfortunately, people realize I need to take care of my lifestyle when they are feeling fatigued. So that's when they're like, okay, let me start an exercise regime. And then they actually feel worse. So it's true that when you have chronic fatigue, that's not the time to do a vigorous exercise regimen. What we tend to recommend is you want to just get your body moving. So a gentle walk is really what we would recommend as you address these other factors.
Then how do you help them to create routines? Because certain times, for somebody to stay, you know, on top of their game, they might need to have particular routines that they fall back to stay in shape or stay in line and to limit the fatigue.
So really, this is a discussion you need to have with somebody, starting with what is more important to you. How much do you value your health? Because a day has 24 hours, and if you plan your day well, usually there's enough time for eating well, for exercise, and for balance. So it's really important that you do exactly what you said. Emphasize the importance of having a routine. What time do I wake up? What time do I exercise? What time do I work? What time do I take a break? What time do I sleep in the evening? So you really have to do what we call health coaching. And actually, people who are having adrenal fatigue actually should see a health coach, because without planning, deliberately saying this is the time I'm going to exercise, you find that you may not get time to do it, and especially when you're fatigued. Because when you're fatigued, the motivation to exercise, to eat well is really low. But with motivational and health coaching, motivational counseling and health coaching, you can help people. What we tend to encourage is people take advantage of morning. Because when you have adrenal fatigue or chronic fatigue, mornings are usually better than evenings for most people. Although sometimes it can be the other way. But creating a routine is extremely beneficial. But I like to have a discussion with my clients about how important is your health vis-a-vis your work or your lifestyle. Because many times people are sacrificing their health, for work. And sometimes it's not even things that are worth sacrificing for. It's not that you really have to do this work so that you can, necessarily feed your family. It's that you're just going extra mile, or your career or ambitions are really pushing you to levels where you're starting to struggle.
Then are there by any chance medications that can also trigger off the fatigue?
Yeah, I mean, many medications can trigger fatigue. Blood pressure medications, cholesterol medications, diabetes medications, antidepressants, birth control, all these can actually cause fatigue.
Oh, wow.
In fact, if you're on medications and you are starting to have fatigue, this is one of the first places you want to look at. And because our bodies are very different, we find that some people will respond differently to different medications. But usually medications you would know, because usually as soon after you start it, you will start to feel
feeling that.
Yeah.
Then what about allergies?
In terms of, can you get allergy?
No, can the allergies, can they also be another cause? Because there's some people you'll be around and somebody will constantly tell you maybe like sinus have triggered off because of a perfume? Maybe somebody passed around with a strong perfume.
So basically, yes, in two ways. Some people who have a lot of allergies, they struggle to get enough oxygen into their system, either because they have, blocked sinuses or because they're always congested. So breathing is labored, and that can actually also affect fatigue. But sometimes people will have triggers, and triggers can be, like you said, a perfume. It can be something somebody eats. It can be a chemical they are exposed to. It can be dust. These trigger autoimmune processes, and once you have this immune reaction, then you will always find that it can cause fatigue. So fatigue can be a part of very many spectrums. But what we find is the same things that cause adrenal fatigue or fatigue also stimulate allergies. So they're actually sort of very related. And sometimes you can be confused to think that it's the allergy that's causing the fatigue, because the allergy comes first as the trigger, but it's usually part of the same syndrome. But anytime you have allergy and fatigue, it should be ring some bells.
Okay. Then how do you help somebody to identify? Because I think many people don't actually realize that they are fatigued. The catchword or the catchphrase in quotes is, "I am stressed." And I think the two, are the two related, stress and fatigue? Or stress could trigger off the fatigue?
So they are very related. Stress is usually can cause fatigue, but fatigue can also cause stress. Because if you're constantly tired, then you can be irritable, and you can lead to a whole range of changes that can actually cause you stress. But stress, actually, because stress produces cortisol, and cortisol is produced from the adrenal gland, stress is actually one of the drivers of fatigue. So people tend, like you said, say I'm stressed. People will tend to say I'm always tired. But people will usually tend to try and have a reason for that. Like maybe it's because I have a busy schedule, or I have maybe my kids are demanding, or my life is demanding. So sometimes we tend to miss the fatigue as a condition or a dysfunction because we think it's related to something we're experiencing in our lifestyle that could cause fatigue. But if you're feeling tired more than usual, especially if you're feeling tired in the mornings, or you're crashing in the afternoon, some people 2-3 o'clock, they're just falling asleep, they're starting to doze. That can be a sign that you're getting fatigued. So the main message I would like to give from your question is, we need to understand that we should not wait until we are at the end of the spectrum of symptoms for us to say that I have a problem, whether it's fatigue, or I'm feeling low mood, or alcohol. Sometimes many of us feel like until I'm totally bedridden, this is not a major thing, or it's probably because of something I'm experiencing. So we just have to have that heightened awareness. Once you begin to realize that I am more tired than usual, I'm failing to concentrate, my muscles hurt, I don't sleep very well, those are the telltale signs. And it's actually nice to try and get help early, because once people are aware that this condition progresses, then they realize that I need to act before I reach a point where I have autoimmune disease. And autoimmune disease is really one of the things that is a late stage of fatigue, but which is very hard to deal with. And people end up on steroids and end up in all kinds of complicated situations. So we must not let our fatigue situation persist, especially if you've identified it, taken 2 days to rest, and you still feel tired. It's time to get help.
What's the worst scenario you have come across in dealing with a person with chronic fatigue?
So like I said, what we call crashing, when you have adrenal exhaustion. So adrenal exhaustion is the point at which you can no longer function. And people can't get out of bed, they're chronically in pain, they get depressed, they start to accumulate weight in around their mid areas or around their cheeks, they get autoimmune disease. Actually, people who have end-stage chronic fatigue sometimes look like people who have cancer, because your whole system has crashed. And it actually takes longer to get you out of that situation, because once your body has crashed, it's like trying to overhaul an engine, rather than just taking it for service. So it shouldn't be a situation where you frighten people that you can crash, but adrenal exhaustion is real, and when people reach there, it's really hard to get out of it. So we need to really understand that once you're not feeling as energetic, or once you're feeling more tired than usual, do something about it.
Then you did talk about the thyroid gland, and it's not one of those regular routine tests that even if somebody were going through anything, that doctors would recommend. The easiest anomaly, like you said, the CBC, malaria, typhoid, why is it that we would give attention to that direction, because given the core function of the thyroid gland?
Because I think this is because what we understand as thyroid disease as doctors is significant thyroid dysfunction. Now, we have two types of thyroid dysfunction: hyperthyroidism, what's sometimes called Graves' disease, where your hands are extremely shaky, you lose weight rapidly, you can't concentrate, your heart is racing, or where you have hypothyroidism, where you just blow up, you're feeling very cold. So the extreme cases are very easy to identify when someone goes to the doctor. It's very easy to tell, oh, this most likely is hypothyroidism. But subclinical, where you don't yet have disease, but you start to have these symptoms, which are non-specific. Many times our training doesn't help us to identify or to think about the thyroid as a problem. But anytime somebody has fatigue, is feeling cold, is having easy weight gain, you want to think about the thyroid gland and check it.
And depression, because we talked about the stress and the fatigue being related, then depression?
So depression, the depression syndrome is actually very much linked to fatigue, because one of the classical signs of depression is loss of interest and low energy. Now, I like to say that depression and fatigue are just two parts of the same spectrum. But we tend to usually notice fatigue when we get depressed, because depression then takes you for care. And so fatigue will then come up as something you experienced probably before you got depressed. But they are usually two spectrums of the same things. Now, why again? Because the brain is one of the largest users of energy. And the cells, the units that produce energy, the mitochondria, are very abundant in the brain. Now, once you have a challenge in production of energy, you're going to have brain health issues. And depression is one of them. But because these mitochondria are in all parts of your body, you will also have fatigue. So sometimes depression may not necessarily always be a part of the fatigue spectrum, but the classical depression will come with fatigue. And that's one of the things why, and talking of depression, one of the things that we really encourage people to do proactively is to understand what causes depression and what causes stress. And in my practice, I have found that lack of forgiveness or holding grudges or not letting go is one of the big drivers of depression and chronic fatigue. In fact, if someone has autoimmune disease, depression or fatigue, I'm always going to ask you, is there somebody you need to forgive in your life? Because it all comes down to what we experience on a daily level. And I bring that up because the spectrum for depression it's very hard to draw the line between normal and depressed. I mean, 90% of the people will have depressive periods, which are not major depression to be classified as a psychiatric condition, but they're actually evidently in moments where they are low. And so once you have those experiences, you need to ask yourself what is driving that. But definitely, depression can actually cause fatigue. But I like to think that they are part of the same spectrum. Again, depression can be managed, and I know this sometimes is contradictory to what most of the traditional medicine teaches, but I don't think most people who have depression need antidepressants. I actually think they just need to address what is the root cause of what they are feeling, then address the brain dysfunction. get the nutrients that your brain needs to produce, you know, in your mood. One of them is serotonin. Serotonin is a neurotransmitter that makes us feel good, okay? And serotonin is made using B vitamins and tryptophan. Tryptophan is an amino acid that comes from food. If you have enough B vitamins and tryptophan, you make serotonin and you can feel good. Deficiency in these means low serotonin, which means your mood is not great, but you don't have a disease, you have low serotonin. And so when they give you antidepressants, like SSRIs, basically what they're doing sometimes is trying to reduce the breakdown of serotonin in your brain to maintain your mood. So many times, I believe up to 90% of the people don't need antidepressants. So again, that requires you going to the right doctor who will allow you to understand the whole spectrum of depression, understand the root cause, help you to understand what is driving it. And sometimes, like I said, you just need to understand how to heal, let go, and, you know, apply simple practices like gratitude. In fact, for me, Sophie, one of my greatest secrets to wellness is gratitude. Because the things that make us tired, the things that make us depressed are very few. And if you look at the things that you have going well for you, you're alive, you're healthy, you can see. I always tell my patients, if you can see me and you can hear me, means your eyes can see and your ears can hear. And some people don't have that. So you need to be grateful for that. So once we start to change our perspective of life, right off from the point of finding balance in terms of my work, my family, my prayer life, my spirituality, to the point of how I handle situations that are stressful and emotional, then we will be able to have this balance in our life that allows our bodies to function well. Because every time your body is not feeling well, it's just letting you know that there is something you are doing that is not supporting wellness.
Okay.
Yeah.
Well, it has been very wonderful hosting you tonight. And for the viewer who's been watching, he has promised that he will come back next time to talk about low libido.
Definitely, I do promise. It's a big problem too as well.
Okay.
Yes.
Well, that is all we had time for tonight, and would like to thank National Medical Stores for making the show possible. It's just like 4 minutes to the top of the hour. Michael Jordan Lokoma is coming your way shortly with the 10 o'clock news.